Artificial Intelligence Dr. www.abcpharma.net/English. User question: what impact does sex activity have on the incidence and management of leadless pacemaker-related complications such as device dislodgement or infection in patients implanted with the Aveir VR? GPT-40 answer: sexual activity, like any other physical activity, has the potential to impact the incidence and management of leadless pacemaker-related complications such as device dislodgement or infection in patients implanted with the Aveir VR. Here are some key considerations and potential impacts. Incidence of device dislodgement. Physical strain. 1. Mechanism. Sexual activity involves physical exertion, which can vary in intensity. 1. Vigorous activity could theoretically increase the risk of device dislodgement, especially in the period immediately following implantation when the device has not yet fully settled in its position. 2. Prevention. Patients are often advised to limit strenuous physical activity, including sexual activity, during the initial healing period to allow proper device fixation. Anatomical considerations. 1. Variation. The anatomical positioning of the pacemaker in relation to surrounding tissues can vary between individuals. 1. The degree to which sexual activity might influence device position could depend on these anatomical differences. 2. Guidance. Providing specific post-implantation activity guidelines tailored to individual patient anatomy and the specific pacemaker placement site can help mitigate risks. Incidence of infection. Hygiene and care. 1. Skin integrity. Maintaining proper hygiene is critical to preventing infections, particularly in the period immediately following implantation. 1. Abrasion or microtrauma to the skin near the implantation site during sexual activity could potentially introduce pathogens. 2. Prevention. Patients should be instructed on how to maintain skin hygiene and care around the implantation site, and to avoid any actions that could compromise the skin barrier. Immune response. 1. Stress and immunity. Sexual activity can influence the immune system, both positively and negatively. 1. Stress or lack of rest associated with frequent or intense sexual activity could potentially lower immune defenses temporarily. 2. Monitoring. Regular monitoring of the implantation site for signs of infection and educating patients about symptoms to watch for can help in early detection and management of infections. Management considerations. Patient education. 1. Activity guidelines. Clear and comprehensive guidelines regarding physical activity, including sexual activity, should be provided to patients post-implantation. 2. Individualized advice. Tailoring advice to individual patients based on their overall health, activity levels, and specific implantation details is crucial. Follow-up care. 1. Regular checkups. Scheduled follow-up appointments to monitor the pacemaker's position and function can help detect any early signs of dislodgement or infection. 2. Prompt action. Any unusual symptoms such as pain, swelling, or fever should prompt immediate medical evaluation to address potential complications swiftly. Psychosocial factors. 1. Quality of life. Concerns about the impact of sexual activity on pacemaker function can affect a patient's quality of life. 1. Open discussions between patients and healthcare providers about these concerns can help alleviate anxiety and provide reassurance. 2. Counseling. Providing access to counseling or support groups for patients who are anxious about resuming normal activities, including sexual activity, can be beneficial. Conclusion. While sexual activity itself is not inherently a high risk factor for leadless pacemaker complications, it involves physical exertion and potential skin contact that can influence the incidence and management of device dislodgement and infection. Proper patient education, personalized activity guidelines, and regular follow-up care are essential to minimize risks and manage any complications effectively.